Good morning, everyone. I think in the interest of time, we should get started. So this is the last webinar of the ACER series, and today we're going to be talking about how to convert didactic presentations into scholarship. My name is Puneet Bhargava. I work at the University of Washington. My other job is editing a journal called Current Problems in Diagnostic Radiology. I've been doing it for a couple of years. Given my background and experience in the writing that I've done, I have learned a process of how to convert didactic presentations into several different things that can give you very valuable academic credit, and we'll talk about that. If you have any questions, feel free to type them up in the dialog box, and we'll get to it towards the end. I will save a little bit of time for discussion in case you have any follow-up questions. If we're unable to address your questions as part of this webinar, feel free to email it to me. And with that, we'll get started. So the goals and objectives of this webinar are threefold. First, we'll understand how to select the most appropriate article format for any didactic presentation you've put together. Second, we'll review common pitfalls and mistakes we make in writing educational articles. And then I'll show you not just one, but I have 6 case examples of different types of didactic presentations that we've converted into manuscripts over the years. So the most important part of this exercise is to select the right journal and the right article type. So you can select the right article type and send it to the wrong journal, or vice versa, and a great article may not be accepted, and which is very demoralizing. So first we'll talk about how to select the best article type. So this is a screen save from Instructions to Authors from Current Problems, and if you read closely, it describes in detail how different article types can be submitted to the journal. What are the names of those types of articles that you can submit? What do we expect in the article? How should you divide up the different sections when you submit such an article? And we keep adding new article types as we go. And so it's very important to read this in the few journals that you plan to submit in, and know the different categories that are currently on offer. This is AJR, so again, Instructions from Authors, and this is how the web page looks like. And they have a PDF document, and they have several checklists that they expect any author who submits any manuscript to AJR to make sure that all of the checklist is complete. Now, when you submit an article, a staff member from the journal will review your article for completeness. And typically it can take a few days to up to 2 weeks for that process to happen, depending on the time of the year. And if you haven't completed the checklist and you're missing certain parts, or you haven't formatted it correctly, the article will be returned back to you, which leads to a delay of up to a month. So not recommended to not read the instructions, and follow these instructions as closely as possible. This is the table on AJR's website. Again, it tells you exactly how many pages of Word documents, what's the word limit, what's the limit of authors, how many words your abstract should be, how many maximum references are allowed, how many figures, figure parts, etc. So something to understand in this, that these are not guidelines set in stone. Most of these are suggested guidelines by most journals, and if you exceed these by a little bit, there is some leeway. Now, of course, if you submit a paper with 14 authors, they may take the paper, but they'll ask you what exactly the contributions were of each of the 14 authors, and you better have good reasons for it. Otherwise, you will have a problem that your article may get accepted and you're only able to include 7 authors. So if you have any questions or concerns, or if your submission is out of the recommended guidelines, feel free to email the editorial manager or the editor-in-chief directly. Again, there are several article types that are rotated off the journal for a variety of reasons. Some of them become obsolete. Some of them don't receive enough citations over the years. And if any article type doesn't receive enough citations, then it's not good for the impact factor of the journal. So several article types periodically are removed from most journals, and you should know which articles are no longer accepted. For example, AJR currently doesn't accept pictorial reviews, so there's no point in sending a pictorial review to them because they're probably not going to take it, and they will ask you to write it in a review article format. This is another screen save from JACR, and what they from AJR again, and it actually describes in a lot more detail about each of these article types, and there are certain article types that you may not be familiar with. For example, some of the underutilized article types are technical innovation, clinical perspective, and others. And it's good to know which of these article types you might be able to package your didactic presentation into. Here's an example of the AJR checklist. This is a screen save from AJR. Now, again, note that AJR takes brief communications on all of these topics, and they expect you to divide a brief communication into 3 parts: what was the problem, what was done, and what were the outcomes. And so, and other things like take-home points. So at the end, they'll have take-home points. So this helps you format your article correctly. Now, you want to know the landscape. Now, you might say, well, case reports, how does the case report fit into my didactic presentation? Well, maybe you have a PowerPoint in which it's a series of interesting cases that you show residents a bunch of interesting cases, ask them to take cases, and you have a couple of cases in there that are really interesting. You have pathology to prove the diagnosis, and you're interested in writing it up as a case report. So you could write up a case series. You could write up your, if you have a didactic presentation on a specific topic, it could become a review article. If you did a little project that you're presenting to your department, it was a quality improvement initiative, it could be written up as a quality improvement article. Maybe you did a survey and you're presenting results of that survey, and once you've done all the work, that's a great fit for an original article. Maybe you've done something in the domain of education. Now, education articles are sort of the most tricky off this lot because there's different nuances and limitations to what you can do in a particular institution. So as long as you communicate the value of what you bring with this paper, and how a reader may take lessons from what you've learned in their own institution, you will be successful. Now, it's very valid to have opinions on certain things. For example, I personally don't believe resilience is great to prevent burnout, and that is an opinion. So I can write an opinion downplaying the value of resilience in burnout, and so that is my personal opinion. I will support it with some references from the literature, but it's a very valid opinion piece, even though it may be contrary to what most people in our specialty believe. You can also write any little projects you've done as learning from experience type articles. And I would also encourage early to mid-career faculty to not shy away from writing on leadership, business, faculty development topics. A lot of the times there is a little discomfort on writing on these topics because we feel that we're not senior enough, or we don't have the authority to write anything substantial on these topics. But I would like to debunk that myth and say you you should write, and in fact, there is less competition in that domain. Big data, machine learning, artificial intelligence is sort of the new thing, and the articles are starting to come out in several mainstream journals. And so RSNA has started a new journal, and they're looking for material. So if you have anything in this domain, speed it up, get it out the door. Do submit in some of these top-notch journals that are hungry for these topics. You can also write for other specialties. For example, if you have a somewhat basic article on how to do, let's say, MR enterography, for example, a gastroenterology journal may be interested in a how-to article for MR enterography. And so it is valuable to write some of these pieces in other journals, especially if you've already done the effort of putting together a didactic presentation on the topic and have collected a lot of good cases. Now, blogging, I'd be a little bit careful, even though universities are starting to recognize the value of physicians writing in the open access domain. You can get a lot of visibility with blogs. Some physicians are now starting to write articles in Harvard Business Review and Huffington Post and others, and it's very valuable. Just communicate with your chair and the chair of your promotions committee to see what value they see in your blogging efforts. So next, we'll go to selecting the right journal. So you should know the landscape of radiology journals that might be interested in any didactic presentation you put together. Now, every journal is different. For example, if your article is very image-rich and is very clinical, it's a huge misfit for JACR, which doesn't really take image-rich articles. Now, if you have a very clinically oriented article, probably AJR is a good fit. If you have an article, if you have a didactic presentation that you want to publish in radiographics, you probably want to submit an abstract to RSNA and display your material. No guarantees that radiographics will send you an invite, but at least the panel will come by and review your material, and maybe they will send you an invite. And then just know some of the other article types and what types of articles are published in various journals. And again, if you've written something up, it should be published. Just because an article has been rejected in one journal doesn't really mean that it's a really bad article and not worth pushing for in other journals. I've had my share of rejections, and I've had rejections in which the article was absolutely trashed, only for the same article to be published on the cover page of another journal. So just because an article is rejected doesn't really mean much. Take the valuable comments from the reviewers, see if you can make your manuscript a little bit better, and then submit it to another journal. Now, I like to automate this process because I like to learn what are the different article types and who's writing, so that in case I'm looking for collaborators, I want to know who's working on what and where they're publishing. So what I've done is I've taken a few journals in which I would like to publish, and I've signed up for what's called the electronic table of contents, and I'll show you how to do that. So you go and find a subscribe button on any of the journals you're interested to publish in, and once you subscribe to them, they will send you these free emails every month, and it'll give you a list of all the topics that the journal has published that month, and in like 2 minutes you can know who's writing what and where. And I find that very, very valuable. For example, I might be planning the same topic in the same journal, and me finding out that topic is already been done or has been done recently is very valuable, because I might try to put in a new spin on the topic, or maybe try another journal, or at the very minimum make the submission a little bit unique than the other submission. So automating this process is a great idea. If you're in a certain specialty, subscribing to a table of contents for 1 or 2 clinical journals is also a great idea. So a title really, really matters. I can't emphasize this enough. Now, for an educator, if you ever ended up making, let's say, a curriculum for MedEd Portal, and MedEd Portal, there's been a lot of changes over the years in MedEd Portal, and it is advisable that during the AUR meeting, you attend a lecture on MedEd Portal, typically given by the radiology editor, Dr. Strauss, and he walks us through, what are the guidelines, what are the pitfalls, how to format it correctly. But if you ever made a curriculum, have the word curriculum in your title. Otherwise, you will always have to explain to your promotions committee, to your chairman, that this is indeed a curriculum, and if you don't have the word in there, to be honest, like, they will take it as any other article. And developing a curriculum is a lot more work. Now, I'll show you an example of a MedEd Portal curriculum that we developed a few years back. But MedEd Portal is sort of very underutilized resource by clinician educators. We've been trying to spread the word for MedEd Portal for a couple of years, and it has picked up, but it's not being used as much as we would like. Now, the advantages of using MedEd Portal is that you can take a lot of unique, different kind of materials and send it to MedEd Portal. They will peer review it. They will give you a DOI number and a PubMed citation. And you can also see, because it's open access, if your topic is very interesting, you'll get a lot of downloads and views, not just from the US, but from around the globe. And you can use this usage report to your advantage and showcase it to show the impact of your educational work. Now, as you're formatting the article, you need to know what are the different sections of your article. For example, an abstract should always be written at the very, very end. Don't try to write an abstract as the first thing in your article, because you don't really even know at that stage what will be the results, or how much value you want to put in the results, because you haven't really refined the statistics in the tables yet. And again, we'll walk through each of these sections. So the title, it should accurately describe the promise of the paper. It should, if it's a study design, it should describe the design. Do not use abbreviations or acronyms. It should be about 10 to 12 words, no longer. But I would argue that you choose an interesting, eye-catching, or reader-grabber kind of titles. Otherwise, the articles, even though it may be on a very interesting topic, they can get lost pretty quickly. Now, let me give you an example. We wrote an article called The Charismatic Radiologist, and it was on charisma and how we can use charisma in interacting with our clinician colleagues. And so when you read an article that's titled The Charismatic Radiologist, you're curious. You just want to see what it's about, and those titles are very useful. Other things, introduction, it should provide adequate background, and it should very clearly point out the gap in current knowledge and why you're pursuing this study. It doesn't actually have to be very long. In the methods section, it's actually the simplest section to write, and it can be even written before the data collection has been started. It must be complete and accurate to the extent that the reader reading your article should be able to replicate the study. It should clearly identify how you did the statistics, and you don't have to talk about results in this section. It's actually, believe it or not, the #1 reason for why articles get rejected. There's a lot of comments in the methods section that the reviewers point out, and that usually leads to bad methodology is one of the commonest reasons for any articles getting rejected. Once you start writing results, you probably want to put your most positive points up at the very top. It's always a good idea to have a visual representation of your results in the form of a table and present the results in a very logical order. So an article is actually a story, if you think about it, and you do not need to repeat in great detail the information that you've already presented in tables and figures. So that'll keep your results short. You can use subheadings in the results if you'd like. Again, statistics. I want to talk a little bit about statistics. So personally, I'm not huge into statistics, and most people that I know are not. And so if you're pursuing a survey or whatever you're doing and you're not really sure about what statistical test to use, find a good statistician and involve them right from the planning aspect of your project, not at the very end after you've collected your data. In fact, we discuss with the statistician what tests we're going to run, and our statistician will actually design our Excel sheet so that they can't complain that we didn't collect this information or that information to run the statistical test properly. So statistics is really important. Tables, keep them simple and show the exact p-value or whatever you do. And if you show multiple tables, keep the format consistent. When you write legends for your figures and tables, they should be such that somebody who didn't really read your article but just read your title, maybe the abstract, and your figures and tables, and just read the legends, should be able to understand all of the story. So next section is the discussion section. This is actually a pretty important section, but you want to keep it to the subject and you want to keep it focused. For example, if you're writing about unusual hepatocellular carcinomas, maybe a line or two about standard hepatocellular carcinomas is enough, and then you very quickly move on to what are the unusual and uncommon manifestations of a certain tumor type. This is not the section in which you present any new data. And you can compare your study with any previous studies, and it's a great idea to actually point out your weaknesses and deficiencies in this section yourself, which actually disarms the reviewer, because if you yourself are addressing the weaknesses and deficiencies and giving the reasons for why they are deficient, again, that is very valuable. Write it very clearly and in plain English. It doesn't have to be very complex, and don't use a lot of very complex medical terminology, and keep it short. Again, it doesn't need to be very long. Now, cover letter. Now, cover letter is really important when you're submitting any manuscript, because you want to talk about what article type it is, what is the background. Most people will do a one-line cover letter, but it's actually advisable to write at least maybe a paragraph, a couple of lines, and making it a little more personal for the editor. If you never submit revisions because you expected your article to be accepted outright, that is a huge mistake. Almost never is an article accepted in the same form that it was submitted. Revisions, almost everybody gets revisions, and while the reviewers may not be correct, you should always be gracious. You should not show emotion, and especially when you're disagreeing with them in your cover letter. It will only hurt you. Write a detailed cover letter with your revision to the editor. Thank the reviewers, praise them for their insight, don't be nasty, and detail every point that they've raised in their notes, and discuss them point by point. And you can use rebuttal, but make sure to cite some references from the literature to say why you disagreed with them. So with that, let's move on to some case studies. So the first thing that I want to show is an article that our group wrote based on physics, ultrasound physics artifacts that one of our residents gave an amazing lecture to his colleagues, and he collected great cases, and I'm just I'm moving through the slides relatively quickly so that you get an idea for for what the talk was about and how we thought about converting it into a manuscript. So he had some background about physics, and had some definitions, some velocities, and different types of artifacts, classifications, which type of artifacts were created on B mode, on color Doppler, and then created these most amazing illustrations himself on PowerPoint on how these artifacts are generated. Then took a lot of cases from us, and basically gave this amazing lecture to his colleagues. And some of the things he did on PowerPoint even had, motion and things flickering. It was pretty awesome. So we encouraged him to write this article up, and we followed the same technique. We first made great looking images, then we worked on the legends, then we had a whole story. We had figures and legends, and we had a full story. Whatever cases that we didn't think are great, we spent extra effort in finding some replacement cases. We emailed the editor because we thought it was an ultrasound physics project. We thought it might be a better fit for an ultrasound journal. So we emailed the editor of Ultrasound Quarterly and sent him our PowerPoint, and he was very encouraging. And we basically wrote up this article, and it's exactly in the same format as the PowerPoint. Pretty much most of the cases were the same. You can see that if you read the figures and legends, not only can you learn about the artifact, it actually describes the case in great detail. So if you want to learn about reverberation artifact, just looking at the images and reading the legend is enough. That's how a good legend should be written. So we basically wrote the same article, and it's all about physics, ultrasound artifacts, and it's actually very popular amongst our residents. They use it to study for boards about ultrasound artifacts. So that's one example that I wanted to show. Here's another example. A few years ago, we all came up with this idea that it would be nice to have some sort of training available in-house for faculty and trainees about statistics. So we had a resident who's now an IR attending in California, and he was MD, PhD, and he was just the master of statistics. And he's a member of AUR, Dr. Utsuri, and so we said, okay, we're gonna send an abstract to the Rankin Ray, and we will choose the most common statistical tests that radiology articles contain. So we looked up several articles, found out which of the statistical tests are most commonly used, and we created real-life scenarios. So let me show you how we created the PowerPoint. This became a lecture. So we talked about how to think about data variables, and then after some introduction, we quickly moved to scenarios. So these are real research scenarios. Like if you have a question, and then what statistical test would you use to answer this question, and why? So basically, we created several scenarios based on common research situations. It became a didactic lecture for those interested in learning statistics, and it was very practical. And so because we had sent it as an abstract, it gave us a deadline to be able to complete this lecture, and also it gave us an opportunity to win an award, and I think this got silver medal at Rankin Ray that year. And then we kind of wrote it up for AJR. And again, most of the work had been done by this time, and it was a matter of putting words to the slides. And here's the final product. So this is the AJR article, and it's called the Biostatistics Primer for the Radiologist. And on the at the UW School of Medicine faculty development website, they have this article posted for all physicians on how to use biostatistics. And this is a very sort of basic to mid-level article on how to think about statistics. And again, I couldn't have written this, but because we started with a problem, we we found an area of need, then we found the experts, and then we put together a lecture locally, and then took the next step of converting that lecture into a manuscript. So that's the other example I wanted to show. Here's another example. So I'm an abdominal imager, but I started my career at the VA, and everybody has to do MSK imaging over there because we didn't have specialist MSK radiologists back then. So I had a slew of great cases of MRI of the shoulder, and the residents encouraged me to put together a talk about shoulder MRI. So I said, okay, I have all the cases, let me put together a talk. So I put together a talk, and then at the end of the talk, I was like, you know what, I have the whole spectrum of injuries that happen in the shoulder. So what should we do with this? And I wasn't really interested in writing it up. So Ramesh Iyer, who's also a member of ACER, now he's an associate professor at Children's. He was a first-year radiology resident back then. He was rotating with us at the VA, and he helped format this article, this didactic presentation, into a MedEd portal submission. So we added a lot of basic details, and each of these are hyperlinks. So if you want to learn about each of these, it'll take you to certain websites. And then we labeled everything in great detail, and we sent it to MedEd portal, and it became a shoulder teaching file. So it started with having a didactic presentation, and then us just being creative in getting some academic credit for the work we did. So so it is a complete shoulder module where it talks about how to do arthrography, MR arthrography, different types of shoulder injuries, and with lots of great labeling and some images. So the other thing I wanted to give a shout out for is MedEd portal user reports. Now these actually look like this currently. So I pulled this one out, and so this was sent to MedEd portal and published in 2010. So it's been a few years now, and about 2,500 or so people have downloaded it and viewed it and whatnot. And I have some old MedEd portal reports, and these have become very short over the years, but in the past they used to give names even and institutions of all the people who've downloaded it and for what particular reason. So when the time came for promotion and I was asked to put together in my promotion packet what was the impact of my educational work, a lot of the material in that were MedEd portal usage reports, because it not only had the teaching files and the curriculums that I'd made over the years, it also came with usage reports. So it also came with who's used it, what country they're in, what did they use it for, and it's very valuable. So there was in the early part of my career, my goal was to do one MedEd portal module per year, and it really did help me showcase the educational impact of my work. So over time, you may develop interest in some other topics that may be leadership, quality improvement, business type topics, and you may give a lecture. This was actually an AUR talk that I gave on collaborative behaviors, and I've given this talk locally also. There was a lot of work that was put into giving this talk, and I wanted to write this abstract concept of how giving, taking, and matching works in collaborative behaviors, this is based on a book called Give and Take by Wharton professor Grant. And after putting in all this work in this talk, I wanted to convert it into a didactic presentation. So let me show you how we did it. So we searched for the correct format, just in the way that I was explaining previously. We found that if we wrote it in JACR, that would have been the best fit for this kind of article. And we thought that it would be a commentary, but the editor thought that it's an original article, because we started with what was written in the book, and then we put our spin on it. and it ultimately ended up being an original leadership article, and it talks about it as a scenario, so what happened, and how do we leverage collaborative behaviors to make a more successful radiology team. And there's some take-home points because that's the format of the paper, and not too many references because you cite the book, you cite the main article written by the lead author. If you've written something similar, you cite yourself and maybe one or two others, and you're done. These can be a little bit tricky because they're abstract, but all of any didactic presentation that you end up putting together can actually be turned into a manuscript. Let me show you another slightly more abstract didactic presentation that we were able to convert into a manuscript. So a few years ago, we started working on big data topics, and we wanted to help our department decrease our losses. So we actually studied 16 years of data for 8.4 million patient visits across all the hospitals of University of Washington School of Medicine to study which patients don't show up and what can we do about it. And the goal was to capture lost revenue from patient no-show visits, and also improve our access to these patients because maybe there were barriers why people were not showing up for their radiology appointments. So we put together a talk, and then we submitted it to RSNA again as an educational exhibit. That gave us a deadline. We made a lot of screen saves. We wrote the legends as we would describe them in our paper. We had some what I call wow illustrations. When you look at something and people are like, wow, I can't believe they did this. And there's a lot of effort into making some of these illustrations, but that's what actually sets your paper apart from any other paper in the journal that you see. So we did all this work, and then we basically wrote it up as an original article. So it started with a didactic presentation of basically trying to learn and teach our administrators on how to decrease lost revenue in the department. So we wrote it up as what started with just a didactic presentation on an abstract topic, sort of a quality improvement project, ended up in an original articles under the Health Services Research and Policy type article. But again, the idea there was that most of these tables and figures and legends were already done by the time we were giving the didactic talk and the educational exhibit. So the other thing I wanted to show, this is the last case study that I'm going to show, is let's say you did something that's new or novel, and you think you're the first person to do that, and you want to write it up, and you're collecting cases, but you want to write a case series. But if you did something new that's a technical innovation, I would write it as soon as you're able to show that that technique is safe for patients. Don't wait to collect 15, 20 patients. Once you do have them, you can write a larger case series, but you should always write your technical innovation really quickly. So you'll see this is a very short, simple article published in AJR about a lateral approach for wrist injection. And basically, you show the anatomy and you show how an injection done on this lateral approach is actually very safe. And so my colleague, Dr. Medvard, was doing this for many, many years. And we decided that we're going to write it up as a technical innovation. So technical innovation is, again, it's an underutilized article type. And he had a didactic presentation, and he would show cases about lateral wrist injections. So with that, we'll talk about some success tips, right? So this cartoon is really funny. No, it's my wife's turn to be the first author for your paper. But the point I'm trying to make here is that it is very important to not fight over authorship. So when you're planning any project that multiple people are going to be involved in, it is very important to set expectations really early. So you want to discuss and maybe just recap the discussion in an email. that the first person does the most of the work. The last person is sort of the mentor on the project, and everybody else is an author in between. And I would encourage any associate professor and higher authors, and maybe a more senior assistant professors, to actually open first authorship slots for more younger colleagues. You will find that a lot more people are working with you if you are willing to give away the best authorship positions in your paper to somebody else. And it actually doesn't hurt your career. I've always focused on being part of good work, and over the years stuff accumulates, and people will know about the good work you're generating. So don't worry about authorships, but don't fight over it. It's like one of the worst things to do. This is another cartoon. I wanted to crack another joke. Guidelines say that we have 5 nurses on the ward. This is Sandra, also known as Claire, Faith, Jasmine, and Nicolette. And the idea here is sometimes the guidelines can be ridiculous, but if you want your paper published, you want to stick to them. And you can laugh over it, but whatever. But you got to follow the guidelines. A lot of thought is usually spent into putting these together for various journals. And just for uniformity of everything that's published in the journal, guidelines are important. So this is another thing that I've learned over the years, that shorter articles are better articles. Just because a journal says that the word limit for a review article is 4,000 words doesn't mean your article has to be between 3,700 and 4,000 words. In fact, if your article is 1,300 words, but it completely discusses whatever topic you're setting out to discuss, it'll work just fine. Actually, some of the most famous pieces are very, very short. The Gettysburg Address is only 271 words. And if you write op-eds for any newspaper, they're actually very, very short. And writing briefly is really hard. I was asked recently to put a vision statement for a job I was applying for, and to just write 1 page. It actually took me 1 week to write 1 page because I had to remove all the fluff. So if you actually write briefly, or somebody in your team writes short, encourage that. There's no reason to go longer. In fact, the more you say, the more criticism you'll face, because you're probably going off in tangents. Again, this is just, I want to harp on getting your titles right. Is very, very important. Like, let's read this title: Understanding Why Patients No-Show, Observations of 2.9 million Outpatient Visits over 16 years. Somebody may not read this article, but they do know that it's a 16-year study. Now that's very valuable. So a lot of time people are making decisions about your career, and they're just sifting through your CV, just reading your titles. And so you better get your titles right. My most famous story about titles is that one year at RSNA we sent an abstract. It was titled CT and MR Imaging of Focal Splenic Lesions. Of course, it was rejected, such a boring title. We sent exactly the same abstract with a much improved title, and the title was Imaging of the Forgotten Quadrant, Unusual and Uncommon Focal Splenic Lesions with Emphasis on CT. Not only was it accepted, we were asked to give a CME talk, and the only difference was the title. There was nothing different about these 2 submissions. So titles are really, really important. Now, if any of your didactic presentation has some data, then you need to think about, how do you write a science article? And I find this very useful. Like, introduction: why did you embark on this study? What's your research question? Is there a need for this paper? Methods: what did you exactly do? Can I read your methods and replicate the same study at my institution? That's what you're trying to write in methods. Results: what did you find? And discuss. And under discussion, what do your results even mean? And keep it really short. And so the sequence of how you organize your didactic presentation being converted to a manuscript is this. First, you need to collect your images. Now, if you have bad images or your images are not great, your article is not going to get much success. So your images need to be awesome. You need to organize your content, which is basically your images, tables, whatever. Create an outline. Once you have a single page outline, you'll realize that you've actually created a mental model of what you're trying to write. Once you have an outline, then you can delegate sections. Maybe there are some sections that are outside of your area of expertise. Maybe you want to use some tables that are sort of published in other journals and you need permissions to reproduce them. It can take up to about 2 months to get that permission, so start really early. Then select your article type. We've discussed article types. Write your figures and legends really, really well. And I use this 3 articles on your desk technique. And so once I select the journal and the article type, I find 3 articles published in the same journal, same article type, print them out, put it on my desk, and I try one article to be, one of those 3 should be outside of my specialty, and I do that mainly to get the format in how the article has to be packaged just right. So I find this incredibly useful. I don't write anything without actually doing this. Writing your first draft is the most challenging part of this exercise. And the first article looks shameful. It is pretty bad in most instances, but that's why it's called the first draft. So when you write something up and it looks really bad, don't feel embarrassed. Send it around to the group. After 3 to 5 people in your group have a crack at it, it'll look so much better. And then title appropriately. We've talked enough about the title. So why do articles get rejected? Let's talk about that. If you picked the wrong journal, if you submitted something that the journal doesn't even publish, if you didn't follow instructions, if your writing was really bad, if your discussion was really long, if you didn't report your results properly, if you didn't describe your methods in a manner that somebody else can reproduce the study, if your study design was poor, if you didn't even revise or resubmit your paper, and you didn't write the paper in the first place, all of these will lead to what you think about rejections. So with that, I'd be happy to take any questions. I'm going to pull up the dialog box. Well, if there's no questions, then we'll end. Feel free to email me any comments, any suggestions for improvement, any questions that you might have. I'll respond to you by the end of the week. And with that, thank you for coming and hope you got something out of this webinar. Thank you very much.